Good morning. It is my pleasure to welcome you to the Community Health Council of Wyandotte County. Our mission here is to improve health and healthcare in Wyandotte County. We really have two things that drive us. One, we believe in practicing radical collaboration, and we also have a bias towards action.
Today is really the culmination of several years of work by both the Community Health Council, Health Communities Wyandotte, United Healthcare, groups that have been working hard for years in our community to try to improve overall health. And the importance of today is it's taking the registration we've done, the enrollment we've done for the Affordable Care Act, and it's putting it into practice of helping people actually use the health care that they have for the first time.
Jerry Jones and his team have been leaders in that group. Because of the grassroots networking we'd already been doing through Healthy Communities Wyandotte, the historic work that all the groups had already been doing, we were able to have one of the most successful enrollments of any group in the nation. In fact, we were recognized by the White House for our outstanding rollout.
I mean, it's obvious that the United Health Foundation believe that health doesn't start in the clinical site. They know, probably they have plenty of data to know that when you provide support to individuals to get better, it gets better.
Healthcare is so local. How do we help our community, our neighbors, our folks that work together, play together to have better health?
We really are leveraging big dollars, but in kind of micro systems where we really feel like we can have a significant impact on those specific communities.
So the United Healthcare Foundation is very pleased to make this $1.9 million grant to support community health workers. We celebrate the work that you guys do every day. It's not easy. It's very hard work, and we appreciate that.
Our focus truly is relationship. And so our goal is really to begin to meet community where they are. So it's to really understand, who they are and what matters most to them. And then we work with them to figure out how we help them get to where they want to go. Sometimes they might need help just understanding, now that they have health insurance, what does it all mean? And then sometimes they might just need help getting to the doctor, getting to the pharmacy, understanding how to ride the bus.
Working with underserved communities, with community health workers to try and really impact a lot of the things that they're under-resourced in. Our goals at the end of the day are for people to live healthier, longer lives, and for mortality rates to go down, for people to have more access to insurance. We want to connect people to doctors that they can afford and who they understand, so that when they are dealing with things like diabetes or high blood pressure, they are able to manage it, and the impacts of those things, it's really critical.
We're really here to celebrate the community health workers. They live here, they play here, and now they work here.
Community health workers have been known for many years to have great impact in the community because of the type of work they do. So what we wanted to do is to bring those type of services for our community. So this grant is very important because it's letting us do that, expanding the number of community health workers in Wyandotte County.
I used to take days off to help people. My ex-manager presented this opportunity, and I said, what is a community health worker? She said, well, it's you're gonna help people find medication, go to their appointments, and I was like, I'm already doing that and I'm gonna get paid for it. And so, so now I don't have to take days off to help people. I'm actually working and I'm helping people. It doesn't feel like a job.
A typical day for me is getting up, meeting someone at possibly different government offices. Sometimes I'm at the clinics and I'm seeing patients, I'm going from room to room. People are very, very overwhelmed by the process, by getting denied so many times. And our job is to understand these things and go with people to these places and advocate for them. And if someone says no to them, then we ask why. I think sometimes they need someone to be like, hey, did you call these people today? Did you do this today? I think that's why we're important.
We will continue to address every opportunity that we have, continue to support our partners, and I think as we celebrate today, we need to give a big hand to the Community Health Council, Jerry Jones and his team, for the work that they've done that have made this grant possible and for the success they're going to have with this grant. Congratulations.